Hello students. Now in previous topic we had studied about the axilla. Now this is the continuation of axilla, that is axillary nerve. Now we are going to see about the axillary nerve, how it courses and what are its root value and all. So axillary nerve is also called as circumflex nerve. Okay, which because it is in also in a rounded shape. Okay. So then it is an important nerve because it supplies the deltoid muscle, okay, which is the main adductor of the arm. So if the axillary nerve get damaged, then it will be hard to abduct the arm because it supplies the deltoid muscle, and that deltoid muscles helps in abduction of the arm. So and also it is surgically important because it's commonly involves in the dislocation and the fracture of surgical neck of humerus, okay, because it is least supported from inferiorly, so there the dislocation chances of dislocation are higher. After that, the axillary nerve is a small terminal branch of posterior cord of brachial plexus, as you can see it in the picture. So it is coming from the C5 and C6. Therefore its root value is ventral rami of cervical 5-6 segment of spinal cord. Okay, C5 and C6 is the cervical 5th and cervical 6th. Okay, so the root value of the axillary nerve will be ventral rami of cervical 5-6 segment of spinal cord. Now we will going to see about the course. So how you have to remember it, that axilla, after that quadrangular space, and after that going to surgical neck of humerus. Okay, so what you have to write in that axilla one, that it is a small terminal branch of posterior cord seen in axilla. Okay, axilla में देखी जा सकती है, ठीक है, छोटी सी ब्रांच है, छोटी सी पोस्टीरियर कॉर्ड की ब्रांच है जो एक्सिला में मिलती है. आफ्टर दैट द नर्व passes backward, okay, is going backward through quadrangular space. Here it lies below capsule of shoulder joint. So if you had drawn the diagram, you will be able to see it clearly, that how it is coming and going to the quadrangular space. Then it passes behind the surgical neck of humerus, where it divides into two branches, that is anterior and posterior. Okay, so axillary nerve is coming to the surgical neck and then get divided into two branches, that is anterior and posterior. So you have to remember in this way, that is it is coming in the axilla, okay, then it is going to the quadrangular space, and after that it is moving to the surgical neck of humerus, and in quadrangular space it lies below the capsule of shoulder joint. So this you have to remember. Now in previously we had seen that course, okay, so course is like it's like our home address, or you can say it as from home to college. Okay, so now we will see about the relations. So relations and branches are like, we are going through the map of it. Okay, so in that map we will going to see that here is that branch, here is that branch. So in this way you can take it in your mind that relation are these things which is in the detail, that if you are going through a pathway, that you will remember that there is a mall, there is a shop over there. So it is like that. So wherever the axillary nerve is going, it is passing from some muscles and going through some space, that is quadrangular space. So you have to take it in that way, so that you will be remember it easily. So now look at into it. The first point in it, that is in lower part of axilla nerve runs downwards behind the third part of axillary artery. So we had seen in that video that I had tell you that third axillary about the third axillary artery. So we know that it is come from the posterior cord, so it is going to the lower part, okay, so behind the axillary artery, and it lies on the subscapularis muscles which is present over there. It is related medially to the median nerve, okay, so median nerve is in the medial side, so it is related medially to the medial nerve and laterally to the coracobrachialis, which is the muscle present over there. Then the nerve leaves the axilla by winding around the lower border of subscapularis. Now that nerve is getting close to the capsule of shoulder joint, okay, in the lower border of, which is present in the lower border of subscapularis. So the nerve leaves from there through winding up there, and then it gets entered into the quadrangular space. Now watch out in the figure, you will be able to see clearly, okay, so what is going on. Then after that the nerve passes backward through the quadrangular space, you can see in the figure clearly, and then after it is accompanied by posterior circumflex humeral vessels and has the following relations. So superiorly it is subscapularis or teres minor, or you can say it as superiorly it is related to the subscapularis or teres minor, and lowest part of capsule of shoulder joint. Then after laterally it is related to surgical neck of humerus. Then medially it is related to long head of triceps brachii, and then in the inferior side, that is downward direction, it is related to the teres major muscle that you can see in the figure. Now you can see in the picture it is getting divided, okay. In quadrangular space the nerve divides into anterior and posterior branch, as you can see it in the picture, okay. So that anterior branch winds around the surgical neck of humerus and deep to the deltoid, and then it supplies to the deltoid and the skin over antero-inferior part. After that posterior branch supplies the deltoid in the posterior part. We had seen there is 3 division of deltoid muscles also, anteriorly, posteriorly and laterally. So in the posterior part the posterior branch supplies, and it also supplies the teres minor muscle. The nerve to the teres minor bears a pseudoganglion, okay, so there is a pseudoganglion present over there. If you want to see that pseudoganglion, just refer the book so that you will be able to see it. And after that nerve gets pierced in the lower part of posterior border of deltoid, you can see it in the picture, and then it continues as cutaneous nerve of arm. So this is the end of the video. Now after that we will going to see about the cubital fossa and brachioradialis muscle in the next class. So we have to learn this out, the axillary nerve and the axilla also, and test will be taken day after tomorrow, so learn it out.